coltsfoot. A great little plant. This one is kind of an interesting plant when you see it. Again, heavily used by the local First Nation people throughout Canada and the United States. But this is a plant where it produces a stalk and a flower in early spring, way before the leaves come out. Usually you have the leaves, then you have the flower stalk, and then you have the flower. Well, you'll find the flower stalk and the flowers early in the spring compared to the leaves' appearance. So the leaves will come along much later. We use the leaves and we use the flower to a degree. We also use the root. And again, it suggests that it doesn't grow locally on the distribution map, but there's actually 2 native species to Alberta, and if you don't watch it, it'll take over your garden. I remember planting some in one of my herb gardens, and we had to have a major event to try to get it out of the garden. It can really take it over, but it likes it slightly boggy, so you can tell if it really takes over, you're overwatering your garden. That would be a typical case. And its leaves look like that. So the reason it's called coltsfoot is it kind of looks like a little bit of a foot of a horse. And that's where it got its name originally. As far as its medical research around it, it inhibits platelet aggregation. And that literally has to do with bleeding time. So how you tell platelet aggregation is you literally create a little wound and you see how long it takes to stop the wound from congealing. You would think on the surface you wouldn't want to stop platelet aggregation because platelet aggregation seals up a wound. But really a lot of people, their blood's too thick and it's causing cardiovascular events, so they need to thin their blood. And so inhibiting platelet aggregation is another way of saying thinning the blood to a degree. It really has to do with the 5-HTP or the serotonin on the outside of the platelets that actually creates this aggregation function in certain functions. But because of that, by the way, most migraine headaches are caused by platelet aggregation. So feverfew will help that, but you can also use some of the coltsfoots to be able to help that and several other things that work with platelet aggregation. It also, as an anti-inflammatory, can be shown to block arachidonic acid metabolism. This becomes fairly significant, by the way, because it's one of the most inflammatory functions. You might have remembered when we were talking about oils, arachidonic acid is part of the omega-6 series, and it produces a leukotriene cascade or some of the inflammatory functions that really cause pain in your body. So we can use coltsfoot to work in inflammation throughout the body and pain throughout the body. You can also keep things in the omega-6 series from going into arachidonic acid and therefore the leukotrienes, and be able to balance the gamma-linolenic acid and keep that high and work with the omega-3 oils in itself. So even though it doesn't seem on the surface, it actually can work with the fatty acid metabolism. But it's traditionally used for respiratory ailments for sure, and it has antibacterial. It was very, very common for the First Nation people to use coltsfoot in their smudges again. So a common thing that would be done is to mix the mullein and the coltsfoot together, either be put in a pipe of smoke for respiratory issues, or actually put in that little smudge, as I say, with the water on the hot coal or the hot rock and breathe it in, would be one of the more common ways to utilize it. It works as a respiratory stimulant and a cardiovascular pressure activities. It also has been used for asthma, and it's also been shown to be antibacterial. So again, a full kind of suite of things we need for respiratory agents has been shown to, in the science, to work. Its therapeutic action is an emollient, a demulcent, an expectorant, tonic, and a pectoral. So it really opens this whole area of the body, but it also soothes the body both internally and to a degree externally. And as soon as you feel it, you can feel that kind of soothing capability of the leaves. Its major constituents are as a bitter glycoside, and it works as kind of a cough dispeller. It's kind of interesting, even its name, Tussiciligo, means cough dispeller. So you can see when its genus name was originally had, it was being in commerce for a long period of time, worked in cough syrups. And I'd have to say, throughout Western civilization, it was used mostly as a cough syrup, not as a smudge, but sometimes used as a tincture, but it was more in a cough syrup. It's a demulcent for persistent cough, especially smoker's cough. It's good used for problems of asthma, pleurisy, whooping cough, chronic irritation coughs. Its antibacterial factors have also been shown to be able to inhibit certain types of tuberculosis. It also is used for bronchial catarrh and the common cold. In Chinese medicine, they also use it as an antibacterial, but as an antitussive, and they use it for asthma. So we have mixed cultures from around the world use it for similar function. Yes?
So if most people's smoking cough is caused by like damaged cilia trying to get rid of the excess of buildup of crap, would it really be a good idea to treat that with something that's going to soothe the cough, or would this benefit because it would help like the mucus itself?
It's a good question that you brought up, because it's kind of a multifunctional thing. Meaning that certainly you want to cough when it's productive to get rid of the extra mucus. But lots of times there's irritation in the respiratory tract. We get kind of a non-productive dry cough that's almost like you're itching a sore. And at that time, that's when you want to reduce the cough. So a good practitioner would know when to encourage the cough and when to discourage the cough. Of course, a productive cough is when you want to get rid of the guck. Okay, but at the second stage, when the cough is still now just an irritant, then you want to stop the irritation. It's almost a habit. I mean, I had a little kid in yesterday as an example, and his cough was at the irritating cough stage. It wasn't working anymore on any of his thing. He had bronchitis in the past. His mother was worried because he was still coughing after a couple months. But it was in its end game. And because it was in its end game, we didn't really have to give anything. I actually, in his case, I gave some flower essence to calm him down, because it was quite obvious from his sensitivity. He was taking on some of the cough mechanism almost as a form of communication of his grandparents, where he spent a lot of time with. They coughed an awful lot. They had a coughing issue, and he'd actually, as a 2-year-old, pick it up as a form of communication almost. So we just had to ease him out, protect him emotionally, and probably it'll go away in 2 weeks. If it hasn't, then I'm going to have him come back, and we're going to work with it deeper. Yes?
If it's something like a liver cough, would you want to suppress it?
If it's a liver cough, yes, you want to suppress it to a degree, because that's a non-irritated cough. But literally, the liver cough is not having to do with the respiratory tract. It will work. It's kind of like a smoke detector going off. Mm-hmm. It's telling you there's a problem in the liver. So of course, if it's a liver cough, you still have to use something like the celandine or one of those things, chelidonium, to be able to work in the inner liver to be able to relax that abdominal function that's happening.
Yeah, and then you could use this to sedate the cough.
Sedate the cough if it's still there. Yeah. And often the liver cough will go away from using those herbs. Okay. So yes, obviously what's come up with this discussion is all coughs are not made equal. And the herbalist has to determine why the cough, what kind of a cough, therefore to know how to treat it. And we've seen 3 different types of coughs here. A productive cough, a non-productive cough, and of course a cough related to a liver cough. But there's another cough that's very, very common, and it's a response to reflux. Lots of times when a person has a digestive problem, they're producing a reflux, what they're going to do, the digestive enzymes are going to go up into their throat, and it can literally eat away their throat. And because of that, lots of times the body will produce a nasal congestion and a postnasal drip to produce mucus to go down and coat the upper part of their throat. So they might come in and say, I had a frog in my throat for the longest time. I keep on coughing. I can't get rid of it. I have food sensitivities to this, and this, and they always come up when I have stress. That stress is further infecting the reflux or the heartburn function of their stomach. And therefore, literally, the upper sinus and postnasal drip is a cure for that problem. So you have to settle down the digestion so you can get rid of the mucus so you don't have the irritating cough. So now we got a 4th type of cough, which isn't a liver cough, which isn't a respiratory cough. It's a postnasal drip cough, but the postnasal drip was actually a cure for the reflux problem in the digestive tract in the first place. So again, it's like any other thing in herbal medicine and holistic health. Our goal is to try to figure out what caused the problem, and therefore we don't want to just sedate symptoms. What we want to do is figure out what these symptoms are a sign of deeper in their body and be able to treat that issue. Any questions around that?